Okay, I'm gonna need you to open up nice and big.
Do you think you probably need to go to the dentist? Hold on. With everything going on right now, there's probably a lot going on in your mind, and that's okay. It's important to know that going to the dentist isn't scary. Healthy gums and healthy teeth contributes to overall health. But it's also important that you're informed, so the next time you go to the dentist in this COVID-impacted world, you feel safe and empowered to ask questions. Before we get into it all, a quick recap on the issue with the help of researcher, lecturer, and director of the Cabrillo College Dental Hygiene Program, Noelle Kelsch.
Infection control is never static. It is ever changing and evolving. When I went to the dentist as a kid, the dentist didn't even wear gloves or a mask.
Federal labor data analyzed by NBC Bay Area found dental hygienists rank #1 on a list of jobs where the worker is exposed to diseases. These kinds of risks can affect both the dental worker and patients sitting in that chair.
Inside that handpiece, there are gears that go around, and viruses and bacteria from the mouth can get down in those gears. When we put something inside there, such as a prophy angle that they polish your teeth with, that can get into the little shaft that goes down in there and go back into the mouth on the next patient.
For someone watching who may need to go to the dentist or has an appointment coming up, what should that person ask?
Does your office sterilize their handpieces? Are you confirming that they're sterilized? Things like, do you clean and disinfect the rooms between patients?
As a patient in the chair, though, I could imagine and I would feel uncomfortable asking my dentist, hey, did you wash your hands? Did you sterilize your instruments? It feels awkward. They're a person of authority.
Okay. So, and I totally get that. So maybe that's something you call ahead of time and ask.
Bottom line is there are going to be a lot of things that are different, and you should be in the know. It's also important not to jump to conclusions. Dentists go through years of schooling, and most of them know exactly how to keep you safe. COVID-19 hasn't changed that. There may be other things, though, that may be a little different. Waiting rooms may be a thing of the past. No more magazines, no more sitting in those lobbies. You may be asked to wait in your car until your dentist is ready for you. Your dentist and dental hygienist may be totally covered up with PPE, even though it's a basic procedure.
Hi, how are you doing? It's still the same person underneath.
Don't be scared. It's for their and your safety. You may be screened for signs of COVID-19 over the phone and again before the appointment. You may be asked to sign a consent form agreeing that you understand the risks. Depending on the office, certain procedures may or may not be performed, depending on what county it's in and whether that dentist thinks it's necessary in light of the pandemic. So stay informed, do your research, ask questions. We've given you some of those resources in the description. If you like this video or just want to connect with us, find us on social media or check out our other projects at nbcbayarea.com/investigations.